I'm going to try and do a quick lecture on Unit 5, Injury Prevention in the Healthcare Setting. One of the most important things that you're going to learn through this unit is that preventing accidents is of the utmost importance. We need to be proactive. We need to keep them from happening. OSHA. OSHA is a term that you need to be familiar with. OSHA is Occupational Safety and Health Administration. They are responsible for the employee's safety. They're there for the worker, the employee. MSDS, this is a Material Safety and Data Sheet. Your book may use a different term, so you might want to look at that. This is an OSHA requirement. It's important to know what's on an MSDS, and that is basically any kind of chemical that's used in a workplace. There has to be a record of what is in that chemical, what ingredients, what the dangers are, how you would treat it. So if you splashed this chemical in your eye, what is the treatment for that? What's the emergency procedure? And safe handling of that product. This is a picture of a sharps container. Sharps container are what? Needles, glass, anything that's sharp would go in there. Don't fill it past the certain line, and make sure you use gloves when you put something in the sharps container, because there may be blood or body fluids on that in opening. Biohazards. Biohazard bags are for anything contaminated or infectious waste. You can see the red bag there. If you're disposing of infectious waste, make sure you're wearing gloves, and remove your gloves and wash your hands after putting anything in that biohazard bag. Body mechanics. This is another very, very important concept that we will talk about, and that is the way that the body works together when a person moves. And you want to make sure that the basic principles of body mechanics are used anytime you're lifting or moving, because that keeps you and your residents safe. So there are a lot of things to remember when you're thinking about good body mechanics. First of all, whenever you're working with somebody in a bed, you need to raise that bed to a good working level. It needs to be at your center of gravity. You want to stand close to objects when you move them. You want to make sure you have that wide base of support. You want to push rather than push or slide rather than lifting if you can. Use the large muscles of your arms and of your thighs to lift rather than you're using your back. Make sure you avoid twisting. Make sure that you avoid bending and reaching. Go through your book and really look at what it says about body mechanics, because that's very important. So let's talk about restraints. Restraints can be physical or chemical. A restraint is something that keeps a person from moving easily. It can restrict movement, and it does not allow normal access to a person's body. So some of the common restraints that might be used would be a vest or a belt, a wrist or ankle, mitt, etc. If you have all four side rails up, that's considered restraint, and geriatric chairs with a table on them are also considered restraints. We do our clinical in a restraint-free facility, so you will not see restraints used, but it is important to know about them, and they do have purposes. Restraints can never be used without a doctor's order, and can never be used as punishment, obviously. You only want to use restraints if you are trying to prevent a person from harming himself or others. And restraint-free care, that's, like I said, is the kind of facility we're working in. So you have to use restraint alternatives. And it's important to know examples of restraint alternatives. That can be taking a person for a walk, helping with their elimination needs. It could be, distraction, activity, something along that line. Answering the call light immediately. That's really a good one. We talked about social activity, decreasing noise level, managing pain, bed alarms, back rubs, offering food or drink. These are all examples of restraint alternatives. What must be done if a restraint is ordered? So you need to know your facility's policy. You need to make sure you follow manufacturer instructions, because if something would happen and you didn't follow the instructions, you could be liable. Use the correct size and style of the restraint. Always use a slip knot. Never tie a restraint to the side rail. So think how the side rail of the bed goes up and down. If they're tied to that, they could actually, like, you could break their arm when that bed rail goes down. So it needs to be tied to the bed frame. And a slip knot's important because if you needed to release them from that restraint quickly, you need to be able to just do one pull and then it comes undone. Other things that are very important that you know about restraints. If a resident is in restraints, you should check that resident every 15 minutes while in the restraint. When you're checking them, you're looking for redness or swelling. You're looking for cyanosis, which is that blue tinged, gray, pale skin, etc. You need to report if there's any agitation or worsening behavior. Every 2 hours, the restraint has to be moved for 15 minutes, and documentation is very important. Remove the restraints to help provide the resident with elimination. Do they need to go to the bathroom? With their hygiene, with food or fluids, skin care, range of motion exercises should be done when you remove the restraints. Take their vital signs when their restraints are off. So offer comfort measures as needed, those kinds of things. Very, very important to understand restraints. You will see questions about this on the test and on the final and on the state test. So know what you need to know about restraints. Accident prevention. This is very important. Like I said, we want to prevent accidents from happening. What puts a person at a higher risk for an accident? That could be impaired mobility, impaired vision, impaired hearing, dementia, unfamiliar with surroundings. These are all things that can put somebody at a higher risk. Okay, so common accidents in long-term care would be falls, failing to identify the resident before giving care, burns, poisoning, choking, cuts and abrasions. Those are very common, but falls is number one. Falls is the most common cause of injury in long-term care. There's approximately 1.6 million falls in long-term care within any given year. Okay, and oftentimes when people fall, they can fracture hips, they can have brain injuries, they can end up with blood clots, and they will often die. So we want to prevent falls. Remember, falls is the number one accident that occurs in long-term care settings. So let's talk about how we can prevent falls. Fall prevention, you want to first identify if a person is at risk, if they're struggling with their walking, if they are having some kind of mobility issue, confusion, something like that, that might put them at a higher risk, and you want to notify the nurse of that. Make sure you're answering call lights promptly. Don't let the light go on and on and on and on. Eventually they're going to get sick of waiting and they're going to get up, and then that's where falls can occur. If there's a spill, wipe it up first thing, immediately. Remove clutter from walkways. Side rails should be up if ordered. Make sure that their shoes and their clothes fit properly. If their clothes are hanging and dragging on the ground, they can get tangled up in that. Don't leave them unattended in a shower or bath. If you see a problem, you want to report it, like with the loose handrail or something along that line. Make sure their call light is always within reach, and make sure you offer frequent trips to the bathroom. Think about, have you ever had to go to the bathroom really bad and it becomes an emergency situation? Somebody who moves slow or maybe has some issues with mobility, if they're in an emergency situation and they're needing to go to the bathroom, trying not to have an accident on themselves, this is when mistakes can happen. So frequent trips to the bathroom is important. Make sure that you have wheelchair and bed wheels are locked when appropriate. The bed should be in the lowest position. We don't want to rearrange furniture because they're maybe used to a certain thing. And letting them sit and dangle before they stand is helpful so that they don't get dizzy and pass out. And then if there's if a resident starts to fall, you want to use your body to slide them to the floor. You don't want to like put your arms out and try to catch them because you could hurt your back. And then make sure all falls are reported because there's a certain protocol, vital signs that have to be done, a report that needs to be filled out, all of that. Okay, we're going to stop here and I'll start with the second video on identification.